What is a diagnosis? Okay, this may seem like the most simple question in the world, but I think it's important to develop a deeper meaning of this concept to inform our diagnostic approach. So, as we know it, a diagnosis is a label that we apply to a patient. It helps us better understand what treatment and prognosis they'll have. If you recall, a prognosis is a predicted outcome or a disease course or trajectory. So, in some situations, a diagnosis may be labeled as a specific disease, like diabetes, that has well established criteria we use to diagnose it. But in other situations, a disease may have a general label, like non-specific low back pain, for example, which lacks a single anatomic cause and presents in many different ways. For example, low back pain may present as localized to one area. Other presentations, it may radiate down a leg. Other patients may feel worse with back extension and others worse with back flexion. But the reason a general label is still clinically useful is because it guides us on treatment and prognosis. So we don't always have to identify a specific pathoanatomic cause in order to initiate appropriate treatment. More on this concept throughout the course. I don't know about you, but sometimes I get too fixated on giving a patient a specific diagnostic label, which made me do a deep dive into the difference between a diagnosis-focused versus prognosis-focused approach to care. We see that much of medical education focuses on the principle of diagnosing a condition to provide appropriate treatment. There's been that historical emphasis on giving a patient a diagnosis with specific tests and to prescribe treatments linked to that diagnosis. But prognostic decision making, in contrast, focuses less on labeling a patient with a specific diagnosis and more on the predicted outcomes of that patient. For example, if a patient comes to me with a painless, small, soft, mobile lump on their arm, and I've ruled out red flags like, cancerous skin lesions, but I might not know the exact cause of this lump, maybe it's a lipoma or other type of cyst, providing a watchful waiting approach to this suspected benign finding will often improve with no formal management. So in the right context, adapting a prognosis-focused approach to care, we may be able to reduce the risk of harms like ordering unnecessary tests or prescribing medications or performing unnecessary procedures. In the case of this suspected benign lump, I may not need to order an ultrasound or perform a fine needle aspiration or surgical procedure because it won't actually improve patient outcomes.